So what affects the voice? Your voice can be affected by medical problems that are common to all of us. We all get coughs and colds in the winter, respiratory problems, laryngitis, which affects the voice. Acid reflux, heartburn, can cause problems with acid burning the larynx. The steroid inhalers that are used for asthma can affect the voice, as can an underactive thyroid, or hormones, or fatigue. If we're tired, our voices are tired because they are muscles too. How we use our voice can affect the quality of the voice. If we shout and yell, use a strained, pushed voice, that will affect the voice. Sometimes we just get into bad muscle patterns as a result of a cold or a stressful event in our lives, and that can just cause the fine coordination that's required for voice to get out of kilter. The other factors that can affect the voice are emotional and psychological factors. That might not surprise some of you, but some people are surprised to learn that that can affect the voice. And really it's not that surprising. There are a lot of examples in the English language which demonstrate how the voice is a barometer of our emotional well-being. We talk about feeling choked with emotion or a lump in the throat. And if we know people well, they only need to say hello on the telephone and we can tell whether they feel upset or angry or happy. So if you're under any stress, if you're suffering from anxiety or depression, if you're having any relationship difficulties at work or at home, because after all, you're human beings as well as teachers, you have your own life outside of work and you're subject to the same stresses as everybody else. So if you have any stress in your life, that can affect your voice production as well. People worry about things like nodules, which are little benign swellings on the vocal cords. And certainly they are quite common in young girls who are quite loud and lively. But the most common diagnosis we get when people come to see us is muscle tension dysphonia. Dysphonia just meaning disorder of voice, and really it means there's nothing structurally wrong with the larynx, it's moving okay, but the muscle pattern has got out of sync. If your voice changes do not resolve within about 3 weeks, particularly if you don't have a cold, it is advisable to go and see your GP, who can then, if necessary, refer you to an ear, nose and throat specialist who will have a look at your larynx, and if necessary, refer on to a speech and language therapist who works with people with voice disorders.